All right, thank you everyone for joining us to our webinar on the September 26 project. If you're not familiar with the September 26 project, actually Maysoon, I'm going to put you on the spot. I'm going to ask you to share with our audience about the September 26 project.
It was a project started in honor of my late sister, Feda Almaliti, and her son, who passed away in a house fire on September 26, 2020. Feda was the VP of the National Council on Severe Autism and a very, fierce advocate within the autism community. And we definitely wanted to make sure the way she, passed and how to bring awareness to how easy and quick it can happen in anybody's life, family, and that's how it all started. And we're a collective of friends, family, nonprofit organizations, for-profit organizations that believe in this message and believe in spreading awareness that we need to not just be vigilant within our homes, but within our community and assist families who do have a child or adult they're caring for who has a disability that puts them at a greater risk than the normal general population because they do not identify danger and they actually run into danger. And those who love them and care for them, whether they're parents or caregivers, will follow them into danger or death to rescue them. And Feda were the first story and the first date. But this year we have a video where I risked asking other parents who have lost, those who survived, who have lost their child due to elopement, drowning, and fire accidents. So Kelly, do you want to play the video?
Sure do.
Thank you.
One second. Sound okay?
We don't see it though.
You don't see it? Try again.
It might have been your wrong screen, Kelly.
Do you
There
see
you
it? Okay.
Mhm.
Tell me if you, thumbs up if you hear it.
What went wrong when a 5-year-old with autism drowned over the weekend?
This happened to another child diagnosed with autism just several weeks ago. My son Davey was diagnosed with autism at 20 months. He was nonverbal at the time and very affected.
David's determination was nothing like I've ever seen. He couldn't be left alone for 30 seconds. He loved running and he loved the water.
In September 2002, my husband, Davey, and my older son all went to the family lake house. That was Davey's favorite place to swim and play in the water during the summer. And they gave me a break in New Jersey for the night to sleep in. The next morning, I got a call from my sister Connie, who lived a couple doors down at the lake house. All she said is, "You need to get here." I looked up at the nurse. She said, "He is gone. He drowned in the lake."
We have continued to educate parents and other professionals on the importance of addressing safety concerns, such as developing a safety plan for the home, evaluating the dangers in surrounding properties, not just your own, and the importance of starting swimming lessons at a very young age.
I encourage families first and foremost to make swim lessons a priority. Also, talk to your neighbors. Show them a picture of your child. Tell them he or she has autism and should never be outside unattended. If they have a pool, is a combination locked? Be sure landscapers or other service people are always locking that pool gate when they leave. Any body of water is a danger. If a child is missing, always, always check the water first.
It's scary. And it's just like, but to me, honestly, it's just like, that's my whole life. It's like triaging crises.
You are one of the first parents in the state of California and frankly, across the United States to take your battle straight to the health plans, and you won.
A tragic end to the life of a Fremont activist who became a champion for the families of autistic children.
She died trying to save her autistic son's life.
Firefighters found them upstairs. Feda had her arms wrapped around her son one last time.
That's really terrifying.
This autism can be devastating to families.
Michael was 4 years old and he was always the brightest light in the room, and he was my snuggle bug. Michael and his father perished in a house fire on January 26, 2018. A laptop that was charging on the floor near a couch caught fire, and the couch went up so fast there was no way to escape the living room. Always charge electronics on a hard surface.
I learned in school to exit quickly once you see fire. I was not going to walk into the fire when all I could see was coming.
I suddenly knew that I was the one that had to move into action. And we needed to donate his brain to autism research.
As a way to deal with my grief, I created the Michael Lorenzen Foundation. We provide scholarships to students with autism. The community can support families by educating themselves about autism and understanding that every person with autism is different. So it is important to get to know those with autism.
Our families continued to fundraise, participate in research, and advocate for other children with autism. And most importantly, help families with anything they needed for safety, so no other parent or sibling will ever have to go through a loss like I've had.
10 minutes
10 minutes
every 365 days
can save lives.
I do not want this pain for you.
My cousin Mills was a really loving kid.
And that was the first video. Was it?
Almost 60
Sorry.
years old.
Okay.
He was a really big.
Okay. All right. Well, I'm supposed to be the host. I don't know. I can never get through those videos. I'm sorry. Okay. All right. So, Maysoon, I don't know how you do this. So
like when I'm trying to find the content, and like the footage for the news sources and the data, it was like just 2 days of hiding out in my home crying, because you hear about all these different stories of families who are grieving, and then then you hear about some families who just break and do awful things. It's like there's just too much reality. Yeah, it's a lot, but I can't even imagine the families themselves who this is their life. Like,
Yep.
yeah, I inherited this battle because I was there and I witnessed it. But I was a mom of a neurotypical child and we got out.
Yep.
She went back in and couldn't bring him out. And that is, and so when I say the family unit as a whole is endangered, it is. Not just the child, and it's the mom, it's the dad, it's the sibling. And you know, that's not something as a society we should turn from and just say, oh, that's poor them, or celebrate another form of autism, which in its right, it's absolutely, sometimes, you know, autism can make absolute beautiful minds, and you know, our children, when they're nonverbal, they're also beautiful. It's all, of course, but when a mind can't identify danger, that means any second we're susceptible to losing not just our child, our lives, but our whole family, because the fabric of the family is built around the care and their empathy for caring for somebody with special needs.
Yeah.
That's all I have to say about that for now.
Thank you. Yeah, these, you know, as a BCBA for a long time, I've been doing this for 27 years. Safety's always been something that I have focused on and been a part of grants and projects. And I know that our goal in this is to bring us all together. There are lots of people. That's why Kate's here. That's why Adrienne's here. Kate Serrano from Alpine Learning Group. There are a lot of people doing great work, and we're trying to bring everyone together for a united front out there about prioritizing the safety of our kiddos. So with that, I'm going to introduce Kate Movius. Kate is the founder of the Autism Interaction Solutions, and has been on TV shows and magazines. She has created an organization here in California and LA, and Kate, I'll let you describe it because it's amazing work where you're training first responders and you're actually using individuals with autism as part of your training, which the typical way, I know as ABA providers, we're often training law enforcement, but the missing piece is we don't include those impacted in the training, and you do. So I'm going to share my screen and share your PowerPoint. And hold on, let me pull it up again and then let you talk.
Shall I talk?
Yes. Okay. Can you all see, Kelly? Can you all see the PowerPoint?
Yes.
Okay. Go ahead, Kate.
Thank you, Kelly. Thank you, Maysoon. Yes, it's hard to stay composed, isn't it? So I created this training because my son, Aiden, who's now 22, by the age of 3, had had his first contact with police officers. What I mean by contact is 911 call contact. Aiden was an escape artist starting at a very young age. He could pretty much get out of Fort Knox. He had his last really critical incident that was potentially a fatal incident in 2014. I always knock wood when I say that because we're doing well now. But he did get out of our house and was gone for 3 hours in urban Los Angeles and was miraculously unharmed. But he was brought to a hospital as a John Doe, and I wasn't permitted to see him for a while. And it was one of the worst days of my life. It did end up, obviously, with a happy ending. So I'm very passionate about what I do. Primarily, I train police officers because I feel that the stakes can't be higher when a police officer is in contact with one of our loved ones. I started doing this about 12 years ago, just for free, showing up at local PDs and offering up my services. And I did find as I evolved in this, that it was far better to have my autistic participants spend more time. You can see here, there's a picture on the left of the deputies, the sheriff's deputies, engaged in an exercise. So I put them through the paces. I make them get up on their feet. I put them through exercises that make them uncomfortable sensorily, that make them disorganized, that make them confused potentially, and that stress them out. And it's trying to give them a sense of what it might feel like to have a sensory disorder, to have a communication breakdown, to be asked to perform things or respond to questions when you are incapacitated. So these are good icebreakers for the deputies and the officers, but they also really imprint upon them why it is that a person with a developmental disability or autism is not responding, is not complying, is not following orders, because our loved ones look great. Autism is an invisible disability. My son is a handsome, athletic young man. So that, you know, should he go running down the street with no clothes on at the age of 22, there are a lot of assumptions that will be made about him, right? The least of which is this person has a severe developmental disability. So I really try to impel these officers and deputies to understand that this is not an act of will that our loved ones are not responding. This is not because they want to be non-compliant, that this is involuntary, really. The other thing that we do in these exercises, as we said earlier, is really get them engaged with the autistic participants. And because my son is nonverbal, you can see here on the right, we have Harry, who is typing. Harry is a non-speaker. And then on the left, we have Gilbert, who is very loquacious, very, very talkative. So this shows the officers, the deputies, how diverse autism is. That you can't just give them 5 things to look for. You know, this is what autism looks like. We all know that you can't do that, that we have such a range of diversity, so that if officers roll up on a situation and they use some tactics that work really well with Gilbert here on the left, those tactics may not work at all with Harry on the right. And all I can do is just introduce them and have my co-trainers show up in whatever state they may be in, and that if there are meltdowns, if there's difficulty and challenges, if very inappropriate things get said by our more verbal co-trainers, that's all part of it. And of course, for the moms and the families, this is a really great opportunity for them to share their experiences. You know, as Maysoon started out our session, you know, you mentioned, Maysoon, the importance of community engagement, because for those of us raising loved ones with autism and other developmental disabilities, it's fundamentally a very isolating life. And what that does is it places us in more danger, as you mentioned, Maysoon, because if we are isolated and we are cut off from our communities, it makes the whole family unit more vulnerable. One of the things that I find very helpful is to have a 911 checklist for families that you post on the fridge or put it in your phone, tattoo it on your arm. Because as someone who has called 911 in a huge state of panic, and you've just flipped forward to LA Found, and I'll talk about that in a sec, Kelly. When you're in a panic and when you call 911, you're not exactly in the calmest state of mind, and you may not remember what is the most helpful information to say. Here's what you need to say, and I can send this as a link as well so that families have this. You want to state the address, obviously. You want to state the nature of the crisis. My child has gone missing, and you immediately state the diagnosis. My child has autism. My child is nonverbal or not very verbal. My child may behave in a way that is perceived as erratic and non-compliant. You also want to, if you can, remember what your child was wearing. And again, we're so sleep deprived. We have so many things we juggle that it's happened to me where I've called 911 and I couldn't remember the shirt that Aiden was wearing. If you can, parents, you want to take pictures of your children every day so that you've got that on your phone and you know exactly what they're wearing. Having that photo will also help in a search and rescue. You want to, they're going to want to know if there are weapons in the home. I know this seems like something you may not think of, but it's a very important piece of information, that we have no weapons here. You want to talk about if police have been called to the home prior to this. Now, we call 911 for different reasons. We call for wandering, and we can call for domestic crisis. We can call when our teens or adult children are in crisis and we are unable to manage that in the moment. That's a really, really potentially high stakes situation when you're calling armed officers into the home for assistance. That is when you really, really want to focus on specifics with that 911 dispatcher. You want to focus on whether people have been called, whether officers have been called there in the past, whether there are firearms in the home, and any triggers that your child or adult child may have. The more information, the better. There have been some tragedies that have occurred because, understandably, in the moment, family members called 911, didn't mention the diagnosis. Officers roll up and they've got someone who's non-compliant and aggressive, and they don't know the full story. So I know these things sound alarming. I know that we don't want to think about them sometimes. We have so much on our plate, but it's important to just list this for yourselves, have it there, so that when you're on that phone and when you're on that call, you've got these things listed out for you. Okay. What we have on the screen right now is LA Found, which is provided in LA County, but this is something that if it's not available in your town, you can request through your local police department. This is a system of trackable, wearable wristbands. It has a 100% retrieval rate. What that means is that every person, knock wood, every person that has worn a Project Lifesaver wristband across this whole country has been retrieved successfully and safely by law enforcement. So this is for use with those with autism and other developmental disabilities, but also the Alzheimer's and dementia populations. This has been, we have 1,000 wristbands that have now been distributed in LA County. We have the LA Sheriff's Department on board with this, and we're going to be getting more wristbands that are available. So it's just as a mom who has a son who's worn this wristband, it's a huge weight off your shoulders. Not that we should get complacent. It's really, though, it's a relief to know that should your child go missing, that there is a way to track. And tracking someone who's gone missing, whether they have autism, Alzheimer's, or dementia, as we all know, that time is of the essence. We talked earlier about the rates of drowning. We saw this, the stories in the short film. Drowning is the leading cause of death by, it's like 90% of those who die, who wander, die from drowning. So this is this is just another layer of safety that we can add. So Project Lifesaver is actually the name of this wristband. LA Found is the name of the program in LA County where we distribute this. I just want to be clear about that. So Project Lifesaver is the name of the program you can ask for if you live in anywhere other than LA County. Anything more you would like me to cover, Maysoon or Kelly? Go ahead, Maysoon.
Oh, go ahead. I was just going to, congratulate you. Just, I don't know, congratulations, but like, it's what a daunting task to take it upon yourself to interact with law enforcement and educate them. And I imagine, they too are so overwhelmed because if you think about it, they always deal with emergencies. And they have to think on their feet, and they have to be able to read the scene, read the person. Is this person? And so your awareness is, I mean, what you've been doing is just amazing. It's crucial. It's like everything, because they are our first responders to an emergency. And so, I mean, thank you so much.
Oh, you're welcome. And I will say that they are very, very happy to get this training. I make the training short-ish for them. I make it 2 hours long so that we pack, there's a lot packed in there, but I watched this evolution from the moment I walk in the room and they're like, oh, it's another training, you know, and they're just not that focused on it, to the end when you could hear a pin drop in that room. And because the rates of autism are skyrocketing, many of them have autistic children or nieces or nephews or cousins. So they line up afterwards to talk to me about that too. So I think it's very helpful for them. You know, they don't want to use force on someone with a disability. It's the last thing they want to do. So I think it's rewarding for them as well. It looks like we have a question.
Yes, it's Jane. Jane, I've unmuted, so you're welcome to speak.
Jane is muted.
Hold on, I am unmuting her.
There you are.
Hello, can you hear?
Yes, Jane.
I just wondered if you've extended it to airport staff. I had an incident with my boy at airport security, and you know, it went through my head, thank God this isn't in America, because they don't have guns in general in Britain. But what they see is a 6 foot, 91 kilo man kicking off near security. And what I know is you've effectively got a little child who's upset, but that's, so my only strategy is to talk very loudly. My son's autistic, officer. Yes. He's not understanding, and just so that everyone around hears me. I'm doing it performatively. Yes. But I wondered if you'd extended your excellent training to airport security.
Well, I would love to. I've had at various points over the years different types of departments come in to experience the training, and I haven't officially trained any airport staff, but I think it's a great idea. Transportation staff I've done, but as you say, that, you know, in America, use of force is something that occurs quite catastrophically and fast because of firearms. So I think you're absolutely right that would be good. I also really like what you said about being performative as a parent or as a caregiver in the moment in a crisis, to not be shy about telling everybody what's going on. I don't think everyone's built the same way. I think sometimes parents feel that embarrassment, or they feel that sense of privacy that they want to keep. I think it's really important to put that aside. If your child is melting down, adult child is melting down at a store, on the train, on the plane, wherever, stating that, and you have to practice this in the mirror sometimes, you know, he's autistic, or, oh, your autism is acting up again, isn't it? You know, or however you want to put it. It helps everyone else. It sort of brings the blood pressure down for everyone else, because then they have an understanding.
Thank you. Adrienne, I know that you raised your hand. Why don't I go ahead and I'll introduce you?
Okay.
If that's okay.
Yeah.
So we have Adrienne is one of our panelists. She is a special healthcare educator at Children's Specialized Hospital. She served as the grant project lead for Living Safely with Disabilities, and as collaborated with subject matter experts organizations. She's developed and implemented several initiatives regarding this topic, and she's a graduate from Seton Hall and lived her experience. Sorry, Adrienne, I'm doing it quickly so you can talk back on the topic, but please go ahead. You were going to comment on this topic. You have to unmute yourself, Adrienne. There you go.
I'm very appreciative, Kate, of the work that you're doing with people with autism, right? And usually, in my experience, I've trained police officers and emergency responders for many years, and many have asked, you know, why can't we just be with the people themselves, right? And it really, they're very hands-on, they're very need to know, and so I think it's really important, and I'll talk about that when I speak in a little bit. But you mentioned about the, Jane talked about the air travel, which is challenging for many reasons, disclosing or not disclosing. And there are so many multiple levels of security and agencies that are involved in air travel. So it's not as easy as training a community emergency responder. So it's complex, Jane. It should be done and needs to be done, but it's definitely a much bigger systemic education that needs to be worked through. So thank you. Would you like me to start?
So so just to bridge this gap a little bit, now that I've composed myself. So as part of the September 26 project, we're bringing everyone together, right? And in my work over the years, there's two parts of this, right? And one is training the first responders, training law enforcement, training fire departments, training the volunteers that are part of each community. Each community has volunteer emergency responders when there's some kind of natural disaster emergency happening. So training those groups is vital. The other part of that is helping families to be as prepared as possible, because the families are the ones waiting for first responders to arrive, correct? And so providing families with that opportunity. And I know in talking with families, particularly families with more severely or profoundly impacted children, adults on the autism spectrum, is they tell us, this is the last thing I'm thinking about, right? I'm thinking about everything else. And what we're realizing is the safety has to be one of the primary things that families think about and are prepared for. And so, Adrienne, I know you've done a tremendous amount of work on this topic. And so now, please, I'm going to turn the floor over to you and let you share. You have amazing tips for families and other providers working with families.
Sure, thank you. So before I start, I do also have a son around 22 years of age, more on the severe side of autism. He is not a wanderer, a looper. He has physical disability, which actually prevents that from happening in many ways. Yet he has walked out the front door, or I should say crawled out the front door, but not able to go far. So there are other disabilities, very often, whether they're mental health or physical or other, that often go hand in hand with autism. So autism kind of doesn't happen in a silo, right? And so these are very complex conversations that we should be having with our local emergency responders and others. And that's where I would like to go today with what we just completed. I'm going to share my screen right now. There we go. So I want to make sure you can see what I see. Do you see the Living Safely screen, everybody? Yeah?
We do.
Great. Okay, so in the next few weeks, we will be releasing Living Safely with Disabilities and Special Health Needs. And yes, this does include autism. It includes people with mental illness, people with various physical, sensory. It really is applied to all people. We're proud to have coordinated this online. It's called the Online Center for Safety, which will be on coming soon to the internet near you. It has been created with a team of disability advocates and subject matter experts. It was funded here in New Jersey in part by an Inclusive Healthy Communities grant from our Division of Disability Services. It was part of our Department of Human Services. And we look forward here at Children's Specialized Hospital to increasing this and developing it more. If you're not aware, Children's Specialized Hospital is primarily located in New Jersey. We're the largest pediatric rehabilitation hospital in the country. So I'm going to tell you a bit more about Living Safely that's coming soon. What we wanted to make sure we did was create an accessible center for safety resources and tools for people with disabilities, people with autism, providers, emergency responders, researchers, healthcare providers, technology, and we'll get to that a little bit, technology experts. So we wanted this to be the kind of one-stop center of the things that we created, but making sure it was accessible, understandable, relatable for for the whole community, everybody who gets onto that. We know there are a lot of resources out there, but we wanted to make sure that those that were on this site that we created or adapted were accessible, relatable, and understandable. The website here, you can see it's going to be separated, or it is separated into 4 different categories. We have safety resources, safety tools, community safety conversations, and safety advocacy and information. So in the safety resources section, you will see here that we have every resource that I'll share in just a second. We have many resources on here. Each resource is available in English and Spanish, but it's also in multiple formats depending on the learning style or need of the person, or how we are working with teaching the person with autism. So we have it in plain language. We have audio only, narrated picture stories, which is what we called a social story, but narrated, text with images, and picture stories. Again, that's without the narration. So these are the different options for every single resource that's on the website, so that however you need to be using this resource, it's going to be presented in a format that is accessible for that person. The categories that we have currently on Living Safely are community safety, emergency preparedness and response, fire safety, health and healthcare, home safety, internet and technology, law enforcement, personal safety, and recreation safety. This is just the beginning. You know, we need water safety more here, and we do cover water safety, which I'm going to talk about in just a few minutes. It is weaved in here, but in the short time of this grant, we can only do so much. So this needs to continue, and these resources need to develop, and partnerships need to continue. In the safety tools section, we have things like information about me, right? And things that you would need to know about a particular person. We have fire escape plans that, again, are simple and relatable to a person who with autism or other disabilities. And as Kate mentioned before, we have something called the elopement and wandering prevention form, which has a lot of that information about potential, favorite places that a person might go, and the triggers and the calming methods of that person. So that's on the website as well, the Online Safety Center, and there's more. In the community safety conversations, this is something that was very important to us, is to provide emergency responders, local emergency responders, with talking points to have communication with their local residents with disabilities, people with autism, their family members, people with physical or sensory disabilities. How do I find out what their safety needs are? And these sheets here help the emergency responders have those conversations with their local residents with various disabilities. We have these talking sheets for police and law enforcement, fire, emergency management or OEM, and rescue. So we have given a gift to local emergency responders, saying, have these conversations before an emergency happens, so that you have more information and you're able to have these discussions. The next section is called Safety Advocacy and Information. And here we have 4 different really great things to offer. The first is called a Coalition for Living Safely with Disabilities and Special Health Needs. And we invite everyone on a LinkedIn page to share, as we're doing today, different organizations, people with disabilities, anyone who is a stakeholder for safety, to have these conversations and start to partner more and share what they're doing, so we can really ripple effect what we're doing and safe and make it much more solid and strong. We have many public service announcements that were made either mostly by a person with a disability involved. We have people with autism giving our water safety PSA. We have people with brain injury, but we also have people in organizations providing safety related information. Guidance documents. I really am so excited, Kate, what you said earlier. We have provided a series of guidance documents for emergency responders, for state agencies or local agencies, others, to bring forward we're providing recommendations for them of what to do, how to increase and better perform safety training or community education, or provide resources that are accessible. There's many things that are on there. I think there are about 5 guidance documents that are available. And the last one is the Inclusion and Innovation White Paper. This is really important to us. We had a summit. It was about I believe there were 11 sessions in the summit, and what we focused on was bringing together people with disabilities and safety stakeholders in several safety topics, and what this really comes to is called inclusion and innovation. So if you're familiar with augmented and virtual reality, we feel that could be a method to further improve the training that we're doing with regard to safety, that we can have measurable outcomes. So right now, many of the trainings that are happening right now, we don't know if they're good or bad. In this type of environment, we have a possibility of making sure we potentially can practice safe things, unsafe things in safe environments. So I won't go into the detail here, but I look forward to sharing that white paper with you. Really has much opportunity. We talked about accessibility and respect for people with disabilities and so much more in this white paper. Just giving you one example of a PSA that we did. This one, it was called Safety Signs and Symbols. And another one that is on water safety, and that's the topic that I'm going to talk about today, is water safety. So I know Maysoon spoke a little bit about this, Kate, and it's fatal drownings, according to the data, usually occur in ponds, rivers, lakes near a person's home. They also occur in pools. We know that. Children with autism are 160 times more likely to die from drowning than other children. Approximately 74% of drownings occur after a child has wandered. To go back to what was said before with wandering, I had the honor, privilege to present safety, these autism and safety issues, including wandering, drowning, to the IAC, which I guess that was last year, the Interagency Coordinating Council, to really advocate that we're not doing enough for this. And we know nationally there are so many organizations doing that. We really need to make this stronger and better, because we want to prevent that wandering so we can prevent these drownings. Drowning can start to occur in as little as 20 seconds and in less than 2 inches of water. So it's not just pools, rivers, lakes. It can be in small buckets, in bathtubs. It could be anywhere. So with regard to water around the home, I kind of tell people to go onto Google Earth and kind of take a picture of their home. And then I ask them to kind of go back out a little bit, and then even more, and even more, as we can see some of this there, getting to some really big water sources, right? So this is where that Google Earth can really come in handy, and also having those conversations with the local emergency responders and letting them know, what your concerns are. For the local neighbors, you would likely want to have a conversation with them about, safety with their water, their pool. So if you own a pool, you want to make sure that pool is enclosed with a gate, and there are, depending on where you live, there are different ordinances of how high that gate needs to be, but it should be a self-closing gate, and there should be a latch as high as possible to prevent someone from coming in, and alerting neighbors with pools about safety precautions, particularly about your child. Or, and I say child, but this could be adolescent and adult as well. Research has shown that water safety and swimming lessons are most effective to prevent drowning. So there are many local recreation providers that provide specialized water safety training as well as adaptive swimming lessons. So both of those are available. Please reach out to your local providers and to your community asking for those. And if they're not available, please try to get those available in your area because they have been shown to be the most effective. And overall, we want to make sure that we make an elopement prevention safety plan, as both Kate and I mentioned, explain rules and instructions clearly in multiple formats in ways that are understandable and relevant to that person. And it's not just once, it's multiple times all the time. We want to make sure it becomes a motor memory and they know who to ask and what to do. We want to, again, arrange water safety instruction and swimming lessons as early as possible. When out in any kind of, whether it be a boat or other, vehicles, on water vehicles, make sure that certified life jackets are used. Those floaties and pool noodles are really not a substitute for life jackets. And we want to remain alert near any water source. And we often see somebody on a phone, somebody distracted, talking to someone else. That really, that's in my experience when I have spoken to emergency responders and others, it's those distractions that really where the trouble happens. One tool that I wanted to talk about, and this is not part of living safely, but this is one thing that we can, again, help with communication in the water. When they're in the water, sometimes it's color-coded visual aids. And these are just an example. When I need a break, I can try again, time to get out of the water. Once they see this red card, they know they need to get out of the water for whatever reason it might be. Maybe it's because they feel that they need a break, or maybe they're getting tired, maybe it's because of a behavior, but these or any other visual tools, really incorporating them within water safety can be very helpful. I'm going to emphasize again that on Living Safely, the one that's coming up in just a few weeks, and we'll make sure we share it, there is a water safety PSA. On that water safety PSA, you can see some of the images here. It says, when I'm in the pool, I walk carefully around the pool. I never run. Another one is, I should only swim in an ocean, river, or lake if I ask permission. These areas can be dangerous. And another part of the PSA is I never play near pool water drains. So these are just 3 quick slides that came from that PSA. I look forward to sharing with Living Safely with all of you. Again, please feel free to reach out to me. This is my contact information. I am so safety focus when it comes to disability. This has been something I've been doing for many years, and I look forward to having these discussions with anyone who wants to talk about them. So please feel free to reach out to me anytime you'd like. So I'm going to pass that baton back over to you, Kelly.
Adrienne, when will this information be available?
Living Safely, we're crossing our fingers, will likely be the 2nd week of October. So really pretty sure we're almost done. So it actually, it's pretty done. The only thing we have left to do is add a walkthrough explainer video onto that onto the website so that people know how to use it. Other than that, we're done. We're ready.
Fantastic.
Mm-hmm.
Wonderful. Thank you. That's incredible work. And before I turn it over to you, Maysoon, I will share that one thing we'll do is link this information onto the September 26th project website. If you go on the September 26th project website right now, there are simple tools to guide you through safety preparedness, and then you take it to this amazing in-depth level that we'll want to share. I'll end my portion before Maysoon speaks that as a call to action to my fellow ABA providers, we are the folks that are providing intensive hours. We are the folks that are in people's homes. And as part of any initial intake assessment, ongoing discussion, evaluation, I have urged everyone, and I feel very strongly, that an environmental analysis regarding safety in the home be a part of our work as ABA providers. The Living Safely information can guide ABA providers. There are also checklists on the September 26 project that can be easily pulled up and discussed with family members, asking them and ensuring that not only is their home safe and they're prepared, but they have had practice sessions with their child or adult with autism, and that people feel ready and prepared. And so that is my call to action to any ABA provider that might be listening and joining this, and we're not doing it enough. And so we'll close our webinar today with you, Maysoon.
Thank you. I just had actually a question for Kay and Adrienne. You know, these are wonderful programs, but there's only one of you and one of you. So is there a training program in place for parents, volunteers, or a professional that would like to continue what you do in their city, in their community, in their state? Can they reach out? I mean, is there something in place, a program where you can teach somebody to teach first responders?
I don't officially have a program like that, but I would absolutely welcome anyone to reach out to me. And I can put the email in the chat or give it to Kelly. I think you're absolutely right. There are a lot of trainings going on in different states, and you know, it would be great to be able to create some kind of standard. The Autism Society of America is currently working on that. I'm on a task force with them. We're trying to come up with some guidelines for training first responders. So that's kind of a first step.
I will absolutely agree, Kate. When in developing Living Safely, I mentioned earlier that we've determined that there are not many safety outcomes for trainings that are out there. So this goes from even when you teach a child to stop, drop, and roll to our law enforcement and fire trainings. Yeah, that was a really great training. It was so helpful to me, but we don't really, we have no way to measure that. So that's where that coalition we're hoping that will be available, that it actually is available on LinkedIn, can have these conversations and start standardizing and bringing those silos together so that we are unified and really providing measurable outcomes for safety, that we truly are improving the safety of people with disabilities, people with autism in real and meaningful ways. And these are that there are consistent, standardized best practices throughout the country. I couldn't agree with you more, Maysoon.
Yeah, we need something, because you know, there's only one of us, you know, one of each, and I just feel like I'm just brainstorming out loud, and I, you know, especially for our project, I mean, we are a coalition of volunteers and family and friends. And I was like, how, you know, but we are a nonprofit, and I was thinking, oh, I think I'm going to reach out to high schools and talk to juniors and seniors on assisting me with, you know, whether it's, you know, pulling data, sharing content, creating content. They're masters of this. They're always consuming, creating, or just sharing, even if they don't even create. I mean, the amount of time they are online is
unbelievable. You're right.
And
I'm sorry, Maysoon, I don't mean to interrupt. I would like to share exactly what you're saying. You know, part of the distribution list for Living Safely includes a lot of academia, a lot of universities and researchers and others, so that they can do exactly what you're saying, get the people who can, you know, do this. So I love that. And I think we need to engage everyone at every level, whether it be elementary school, high schools, colleges, university research studies. We're all in this together. It does take a community. So hopefully
we cement the idea, if we can, you know, like if you, it's like DARE. You know, I grew up in the 80s and DARE was all the rage. You know, we always had, you know, people coming out talking to us about, you know, drugs and illicit drugs. And I think that's really shaped, you know, a lot of people in my generation, their perspective about drugs. And, you know, whether they kept with it or not, which I feel like most of them did, ones, you know, my circle, but emergency safety, that we should really take this to the kids. We should really, you know, take it so they can go home and say, Mom, you change those batteries, Mom, you know, let them be aware of their lack of awareness, because it terrifies me when I see, you know, not just my teenage daughter, but a teenager walking, riding bikes, doing everything with AirPods in their ears. And I'm thinking, well, and they're not even, you know, suffering from disability, but they're endangering their everyday daily activity with their lack of awareness. And I just, you know, I feel like somehow, I don't know if it would help. Just
I think at the same time, Maysoon, we should be advocating to school boards to include safety as part of health education, because it's not. So universally, whether that be in the special ed programs, but especially in our universally within what, no matter whether it's in gen ed or special ed, that safety and safety prevention is part of, you know, we do the, you know, the fire, stop, drop and roll, but I'm talking about in real meaningful ways about those batteries in your you know, fire alarm, about, you know, what to do if you get lost, you know, all just things that we just don't teach, that most kids may kind of guess at, but how can we better instruct them and teach them? And I think that should be part of our academic
They
programs.
definitely need to expand on it, because, you know, as a grown adult, my ignorance really probably accelerated the fire by opening up a door. So, you know, I'm not gonna, and I say this often every time I do, you know, and it's not just because I'm just trying to process through my trauma, my, you know, my guilt, but I opened up a door. Like, so we don't know a lot. And you know, if I'm responsible for if I'm a parent and I'm responsible for a child, I can't even imagine the workload and the details and the vigilance required of a parent or caregiver of someone with special needs or severe autism.
I think Kate would agree with me that potentially we should be going to local, you know, we should be advocating to local, you know, townships and local areas to have that community education to increase it. We need to do more. Maysoon, I cannot agree more.
I think a collective goal would be, I love the idea of school boards and getting the schools involved, not just schools, you know, special ed or, you know, schools that specialize in within the autism community, but every school. And, you know, one of our initial goals, you know, between Kelly and Jill and my sister and was involved initially, was we would like this to be on the calendar, on a federal calendar. Hey, today we have Happy Ice Cream Day, National this day, National this day. Well, how about National Emergency Safety Day? And on this day, we remember to maybe leave work a little bit early. Maybe we get to leave school early. Maybe we do something to that, some sort of action that is supported by our nonprofit, for-profit organizations, or wherever we're working and living and operating in on that day, where everybody identifies, oh, today you got to go change your smoke alarms, call your landlord, it's been 5 years. I mean, there's a lot of details. I mean, the smoke alarms that were faulty in the house were probably because they were older than 10 years. You're supposed to change them supposedly every 10 years. I would change them every 5 after that experience, you know, but just like there's care on how we care for ourselves. There's how we care for our environment. And I think I just want to close off with the, that this has really shifted my perspective in the last 2 years, that emergency safety is truly a unifying cause, because you can't practice empathy or gratitude, and we preach that a lot in our society, right? For somebody who is different from us or our neighbor, without actually putting it into practice by, or inclusion for that matter. Are we knocking on the doors of our neighbor and asking them, how can I help you? Or, like I remember Feda shared a story of, early Moo was stimming a lot, making noises. This is in the early years when nobody understood his needs, and he was crying all the time and screaming and all, it was horrific. And it would go on for days and nights and just whenever. And so she had a neighbor who was disabled, who had to turn the block with her wheelchair, knock on her door, and just say that, I just want you to know it's okay. And I understand. Why did it have to take a disabled neighbor to identify with a family or a mother of a disabled child? Why we have to profess, stop, he's disabled, don't shoot, don't hurt him, don't what, all that. We have to do that rather quickly, so then they can, okay, regulate themselves and not feel like, okay, we're in danger, or this is crazy, or this is it. That's empathy. Nobody, I can try to spread this word wide and far to every family with a disabled child or adult. It doesn't matter. I have to tell everybody, because we have a responsibility for people who care for the most vulnerable in our society, man. That's empathy. When we can look at these families and these caregivers and say, wow, you guys are really in sacred, you're living with a purpose. It's sacrifice. And, I think that's sacred. And I think we need to honor that. And I'm not just trying to honor my, dead sister and her son. I'm just trying to honor the ones that are living now, that are doing this every day. And, once you witness that kind of sacrifice, not just by living with her, and then the sacrifice of actually her running into a fire, that really, you really have a deep awe, it's constant. I'm constantly in awe of mothers and fathers of severely autistic children. And when I see and when I hear other messages where one side of the other side of the spectrum does not have empathy for the other side, that just it blows my mind, because it's not possible. What you're preaching isn't possible. You can't bless one mind and just say, oh, look at all the, when you're not identifying at this other, on the other side of the spectrum, these minds cannot identify danger like you. I don't want to, you know what I mean? So it's hard for me I continue to want to engage in these conversations about the differences, about, is autism a blessing, and the idea of inclusion, because we have to get to the bottom of this. And I really believe emergency safety will unify this everybody on the spectrum. And yeah, it's not going away. Our numbers are increasing by the minute. And so what does it take for all of us to have an autistic child, to care about one another and each other? Is that what's going to take in society? Does everybody have to have a child, with a disability to care, or to ask, or to say, how you're doing, or let me help you with the groceries? So I feel like that, I'm sorry, it's a long call to action, but I think this is our call to action. And I just feel we can't just tell families with children and adults with disability what to do. We have to tell families as well who don't, what they can do for this community. So yeah, we need to ask. It's to keep asking, and we need to be brave about asking. Ask for help.
Yeah, so
In every department, keep asking. That's it.
you said it beautifully. You said emergency safety is a unifying cause. And I think that we'll close out our webinar today with that cause, and that as our ongoing mission for the year.
Thank you. Yeah. And we're working all of us together, and I can't wait for living safety, and I can't wait to, we definitely need to continue that conversation about training.
Yeah.
Because you guys are a great resource.
Thank you, Adrienne. Kate had to jump off to care for her son. Thank you, everyone who joined us. And Adrienne will be sure to link up with when you guys launch your amazing work.
Okay. Thank you, Kelly. Thank you, Adrienne.
Thank you, Maysoon.
Thank you. Bye-bye.